Wellbeing's really, really complex. It's very much something that involves everything that we do, and everybody has well-being. Actually, I have to focus when I'm thinking about my well-being on all areas of my life.
Yeah,
And so
so
it's
you've
much easier just to be like, oh, I've got to take a pill for that, or I must have a good diet. But when you have to put it all together, you realise it actually involves loads of different things, and it's not just as simple as perhaps a medical way of looking at it.
I think well-being is really personal to each
Yeah.
person. So for somebody, their well-being might be, I have to run every day.
Yeah.
Whereas for me, that would be a nightmare. And I think, okay, for me, I think of well-being in three things. For me, it's mind, it's my body, and it's my spirit, I suppose.
Does it mean that you're not ill, or does it mean you're okay, or does it mean you're actually living your life in an enriched sort of way? I sort of like to think it's about fulfilling yourself and what you want in life and things, rather than just not suffering.
Overall well-being, I think, is how you feel generally on a day-to-day, how you cope with certain things thrown at you, and how you perceive life generally. We talk very much now about physical well-being. We talk about what we eat, and I know
Constantly.
that's really pertinent to you.
Yeah.
What are we putting in our bodies? Do we smoke? How many units of drink can we have as a man or a woman? But we never ever talk about how much time should we spend on mindfulness or meditation.
Because I know if I take even 10 minutes to just practice some mindfulness, or experiencing, bringing my mind into my body, or just noticing what's going on physically in terms of perhaps anxiety manifesting in my body, if I can notice that and let it go a little bit, then I actually function much better. My local library and gym is really important to my well-being. I have to go there X number of times a week, and I think about the things I rely on in the local area, and they're all services that I think could be given more priority. My library, gym, green spaces with the parks, and being able to cycle around. These are all things that are really important to me.
There's a GP referral scheme that you can go for a 10-week class to lose weight. What about a GP referral scheme to go on a mindfulness course that is funded by the by the government?
Because I've been on mindfulness course and I had to pay for it myself,
and
but
it's expensive.
It was very helpful.
Yeah, but it's expensive.
Yeah,
isn't
but
it?
it's expensive.
Yeah, and that should be part of the government strategy.
Yeah. Actually, everybody has a well-being. Everybody has a mental health, physical health, and it's that I think everybody can therefore develop a mental health problem, but we don't want that for people.
Exactly. So it's building that resilience before it happens. So if you're going to the gym to get fit or keep fit, let's go to the mental health gym to keep mentally
There needs to be all these different things available to support people with all different kinds of, all different elements of their health. And I think that involves something really integrated, and it needs to be considered at all different levels and all different services.